She stole this from Gabby, unknowingly. So, did microcurrent wound therapy. It's pretty interesting. It is a bandage with zinc and copper leaflets covered by a conductive medium, and it promotes the positive-negative charge of the elements. They're approximately $40 for a 4x4 square, which I've seen them for more, but just one of those things that's going to be expensive. And what makes it kind of hard to deal with is that it's only a one-time use. You can only use it one time, so it's $40 every time you use it. Some history on it. In the 1830s, Carlos Matteucci proved that an electrical current was generated by injured tissue. And it took into the 80s for there to be enough technology to do better research on it. And several researchers found that wounds produce 10 to 30 microamps per square centimeter. This type of therapy has been used in treatment of bone, skin, and tendon injuries. Parameter 30 microamps. This tendon is 4 to 40 microamps. And I was doing a little research to see, and these numbers are pretty accurate. And they have tested above. They thought that more amps would be better. Well, that is not true. It actually reduced healing time and had a lot of detrimental effects. Typical parameter, though, is used 3 times a day for several weeks based on the healing progress. So the theory is that it increases ATP synthesis, increases DNA replication, reduces length of the inflammatory phase, increases angiogenesis, and combats antibiotic-resistant microbes. So to reduce the inflammatory phase, the positive polarity of the electric field attracts the microbes and then decreases their motility. So hopefully it decreases the bacteria-caused inflammation response. It pushes fluid into the lymphatic vessels and increases localized vasodilation to allow for better blood flow to the wound site. And to increase angiogenesis, applied microcurrent showed a faster time for vascular endothelial cells to arrange in proper formation, which essentially means that more and better structured blood vessels and capillaries can flow to the wound site. The microcurrent field should be placed perpendicular to the wound direction because the microcurrent draws in the cells, so it promotes cellular migration. And it improves hemodynamics locally at the wound site. Combating antibiotic resistance bacteria. The current causes disruption of the bacterial membrane, which essentially kills the bacteria there. It also alters the pH level, so the wound site is uninhabitable for bacterial growth. And one research, this is what I've read, has shown that 24 hours post-application it was able to kill 100% of the bacteria, which is crazy. But I think there is some exclusions on the bacteria they tested. Does it work? That picture, I know it's kind of nasty, but it's yeah, it's kind of nasty. But that's a 40-day treatment. There's a lot more that goes into it, like the physiological factors of the patient and stuff like that, but it does work. A Canadian Olympic study found that 10 to 20 microamp current shortened a ruptured tendon and ligament injury from 18 months to 6 months. And the 18 months is generalized for like general population, and they did it on Olympic athletes, so there's an obvious difference physiologically. And then a skin study was done on 83 ulcers of various degrees at 400 to 800 microamps, used 3 times a day, 7 days, or daily for 7 weeks. And so the total area was reduced 82% in these patients. And the criteria to get into this study was that your ulcers failed to respond to prior treatment or typical treatment. And that's it.